Morning and welcome to my favorite day of the whole year, Cancer Survivors Day. I'm Dr. Shamli Singhal. I'm the medical director of the cancer program and a surgical oncologist, and so happy that you're here to join us with today. We have a wonderful panel for you today and some new faces. So I want to let them introduce themselves. And to my left is Dr. Shumway. He's a radiation oncologist, and he can say a couple words.
Very good. Yep, John Shumway. And thank you for the introduction. I'm a radiation oncologist. I think I'm the newest member to El Camino Health here on this panel. I'm very happy to be here. With background, I graduated residency about a year ago, and my wife is from the South Bay, and she's always dreamed of coming back, and this is a place that I know and love as well, and we're very happy to be here. And I'm even more thrilled to be at El Camino Health and working with such fabulous people.
Thank you so much. And to my right is Dr. Catherine Taylor. Dr. Catherine Taylor is a psychiatrist of behavioral health and the medical director. So she can say a couple words of introduction.
Yes, hi, welcome. I've been at El Camino for 17 years after leaving Stanford. I'm the chief medical director here for the mental health and addiction services at El Camino. I think you have a great panel and a lot of support and information that we can provide. So looking forward to.
Excellent. And to her right is Dr. Lillian Suhu, and she's a dermatologist, and she'll introduce herself.
Thank you for inviting me to join you today. Hi, I'm Lillian Suhu. I'm a board certified pediatric dermatologist and general dermatologist, and I've been practicing in the Silicon Valley for over 30 years as part of Golden State Dermatology, most recently in Los Gatos.
So wonderful. That's great. All right, so I'm going to start with Dr. Shumway because, the way we like to start this panel is what's new in your field in the last year? What's the trend? What's cool? What's new?
Yeah. So definitely a lot of new things in radiation oncology. I think the major trend right now is our machinery is getting better, our software, our equipment's getting better. We're treating with less margin. So basically we're treating a more targeted area, and that allows us to deliver a higher dose, typically over fewer days. So I think over the next few years, especially, you will see the number of days that patients need radiation is going to keep going down. And as our targets get more and more precise and accurate. Furthermore, there's a general trend in medicine, and certainly our field is very involved in artificial intelligence and automation on the back end, which really helps our processes go smoother and allows us to be more accurate. And that is something that I think will increase and be more and more part of our field over the next few years.
Excellent. And so the idea is that we've done a lot more on the front end of early detection, getting cancer smaller. Then with smaller things, then maybe we could have more targeted therapies and then less damage to things,
Yeah,
right?
more targeted radiation means a couple of things. It means less side effects, first of all. We're treating a smaller area. And second of all, it's just easier for the patients because typically we're doing less days of radiation, so less kind of an inconvenience to their lives.
Exactly. And, radiation often is the end of a long journey for people,
It is often,
right?
yeah.
And so people are tired. It's not that each individual fraction is such a big ordeal. It's just that people are tired.
Yeah. Yep, exactly. That's
People
very
are
true.
tired of this thing. So I'm a surgical oncologist, and so I will tell you that there's so many things that are new in the last bunch of years. So for example, we used to do surgery big and open with big incisions, long stays in the hospital. Nowadays, we're doing a lot of it with the laparoscope and the cameras, and even more of them with the robot. And so the robot has kind of taken over. And so in El Camino Hospital, I think we have a total of 5 robots, and most of the gynecologic surgery is done robotic. Most of the prostate surgery is done robotic. Much of the colorectal surgery is done robotic. So we're really trying to minimize the amount of damage that we do in terms of incisions and long length of stays in the hospital. So, and that is made substantially easier by early detection. So the smaller the cancer, the less intervention we have to do, right? And then there's some diseases like melanoma, for example, where the world has completely changed upside down, right? And with the new medications and new everything, what surgery are we doing? Why are we doing it? Has all come into question. And so there's a lot of things for which you don't need surgery for anymore. So that's cool.
Same with radiation. There's early stage cancers, for instance, a lot of early stage breast cancers now. We are recommending that patients don't have radiation just because our targeted therapies have gotten better, the surgeries have gotten better.
Yeah, everything. All right, so I'm gonna turn it over to Dr. Suhu, and maybe she'll tell us a little bit about, because we were just talking about melanoma. So what's new in melanoma for?
Well, first of all, I think I want to dispel one of the major misconceptions about melanoma, and that is that it always results in decrease in long-term survival. That is absolutely not the case anymore. With early detection, especially stage 0 in situ and stage 1A, thin melanomas have over 98%, almost 99% long-term survival. So early detection, as Dr. Singhal was talking about, is really the key. So we want patients to do self-exam. Also, oh, hi, Dr.
Hi.
Self-examination and come into the office and have their total body skin exams regularly. Whether you've had a skin cancer before or you've never had a skin cancer is the most common human cancer, and it'll be amongst your highest yield cancer screening. So in the office, we will check areas that you can't see yourself, like your scalp, your back, behind your legs, and to do that regularly is going to be very helpful in detecting these skin cancers at a very early treatable stage.
Right, and as I said, the treatment for melanoma has changed substantially. So what used to be mostly surgical disease where we did big operations and tried to chase things down now has become a combination of medicine, of early detection, and then on top of that, when is surgery necessary, right? That's a question that has changed over the last year, and it'll continue to be different. Right.
Right, and early stage melanomas, stage 0 and 1A, wide local excision, which is a in-office surgical procedure, is pretty straightforward. When I have a patient who has a thin melanoma, they get in right away within a few days, at most a week, and we go ahead and do that in-office surgery under local anesthesia. It takes about 45 minutes, and then I follow up these patients every 3 months for a total body skin exam for the first year, and then every 6 months, head to toe for life. And if we do have more advanced melanomas, of course, we're going to consult our oncology team to decide what further workup is necessary. Also, if there's other treatments, and there are over about 14 new drugs that came out for melanoma treatment in the past 10, 12 years now. So I think Dr. Dormady has a lot to offer even our patients with late stage advanced melanoma.
Right, so what we were talking about, Dr. Dormady, is we were saying what's new in our field, right? What's been happening in the last year since we met last?
Let's see. Since we met last, specifically with respect to melanoma.
Oh, no, with respect to medical oncology, like
Medical oncology.
what's the thing that strikes you this year as, wow, that's cool?
Well, it's interesting. Last year we talked a bit about how we monitor cancer, metastatic cancer or residual disease when you don't have metastatic cancer. We talked about the use of these assays like Signatera, looking for circulating tumor cell DNA. I would definitely say over the past year that is becoming more and more commonly used. And in fact, now, as we've talked about at our tumor conferences, it's trying to be implemented in a way where it actually has therapeutic implications, meaning if you do surgery and you subsequently don't detect any circulating tumor cell DNA, can that kind of patient have a truncated course of chemotherapy after surgery, or do they need chemotherapy at all? These are the types of clinical trials that are now being widely set up to try to stratify who needs treatment, because for decades and decades we've known that we probably end up over treating many patients because we can't differentiate who actually needs the systemic therapy and who doesn't. So I think diagnostically and surveillance-wise, that's probably the biggest thing. Therapeutically, because this does relate to melanoma, the immunotherapy continues to explode as a systemic treatment. And melanoma over the decades is just something that's not really that chemosensitive or sometimes even radiosensitive, but the immunotherapy and enhancing your body's own ability to hunt down and police and find melanoma cells works gangbusters. And like Dr. Suhu just said, and Dr. Singhal just said, Dr. Shumway knows too, that, I mean, I've had patients where they presented to the office with widely metastatic melanoma. I'm talking, there isn't a part of their body that doesn't have melanoma in it, from their brain to their, femurs, liver, lungs, and yet we give them combination immunotherapy, and when it works, the disease just disappears. And then you keep them on maintenance treatment. I have probably 10 patients in the office like this who are in complete remission, clear scans, 5, 6, 8 years later. So that's probably the latest.
Yeah. Dr. Taylor, what's the latest for you?
I'm really excited to hear your parts. I think for me, the biggest thing is that since COVID happened, we've really had more of a communication. So the awareness for psychiatry, people are actually talking about it. They're able to talk to each other. So I think there have been changes in the availability and the awareness in the community and for patients, but also new treatments, things like ketamine and TMS that people are now more aware of. So some of the higher level treatments for depression, and just even with the insurances now, more availability of higher level treatments, intensive outpatient programs where you can come 3 to 6 hours a day. The awareness of EMDR or things to deal with some of the trauma and the anxiety. So there's been a lot of continued medication management growth in the options we have. I think there's been an awareness and just the communication, even the fact that I'm here in this panel to be able to talk about the impact, I think is where the growth in psychiatry has been recently.
Well, we spend a lot of time with our patients, and Dr. Dormady is well aware of this issue that people have, and it's a survivorship issue because going forward, we understand from our patients all the time, like we talk all the time about the fear of recurrence, right? The fear of recurrence is an incredibly powerful driver of behavior, right? And I'm going to let you talk about it, but I also want to mention something that Dr. Taylor has 2 hats that she wears. One is her doctor hat where she's a psychiatrist, and she's told me, and she's been treated actually here at El Camino Hospital, she herself is a cancer survivor. And so she wears 2 hats of this. And so you can talk a little bit about fear of recurrence from 2 hats, right? So maybe mention a little bit about it.
Yes, I've actually had cancer twice. I had skin cancer in my 20s when I was in medical school, had to have surgery for that, 4 rounds of Mohs. And I also had breast cancer just over 10 years ago, finished my treatment in April of 2014. Was treated by a colleague of both of yours actually here. And I think just what I've seen as a physician, but also as a patient, really, I think it's important to understand the impact on someone of that fear that follows you around. I even had another scare this year where, they find a lump and you have to address it and all the thoughts that go through your head. First of all, when you get diagnosed, the fear of the unknown, you don't understand necessarily what's happening. Even as a medical physician, person, I knew generally what was happening. I could follow the research, I could follow the discussions, but you still have all those parts where it affects you and you don't know how you or your family's going to manage it. And then even just the follow-up coming in, to say, why do people not come up for their follow-ups in 6 months? Because it can be terrifying to just schedule that appointment or show up for that appointment. Why do you suddenly feel better the day after your appointment when the doctor's told you everything's fine? And I think the realization is that can continue for years, 6 months, a year, even 10 years, where you get some bad news that actually is fine. So I think there's a lot to recognize on the impact on the patients that you might not know, even just as I feel the anxiety that comes on me as I'm talking about that experience. I think it's something to recognize and really that it's okay. Like everybody has this experience for the most part. Yours may be different. You may feel comfortable. You may have ways to address the anxiety and the worry about what happens next, but it's okay to talk about it, and your providers can help because they've seen it before. And if your specific provider hasn't, that there may be a psychiatrist or a therapist who can also help you work that out. Because I think sometimes even just with families try to provide support, but they say, you're fine. And the issue is you may not feel fine. You may not really have a chance to talk about your experience. So being able to just be open with it, I think that that I've seen, at least in psychiatry and in the conversations since COVID and about cancer, is that being able to say something to other people around you and say, this is how I feel, there's actually some things we can do to help.
Dr. Sherman, what do you tell your patients about this?
Well, it's so interesting to hear your story. It's probably surreal going through it as a patient, being a doctor. I've always found that our nurses and doctors, it's that there's even there's fuel there for even more anxiety because you know so much. And sometimes a doctor or a nurse's mind can be their own worst enemy as they go through these treatments. But what I always try to tell my patients is cancer has evolved dramatically such that I tell them, please, let's not get caught up in stage 4, stage 3, metastasis, et cetera, et cetera. I try to stress to them, we have to get our mind around the problem first. And we do that by saying this, you have a medical condition, just like diabetes or high blood pressure. And as long as your team of doctors kind of cleverly puts together the battle plan to address the cancer wherever it may lie in your body, we will keep the disease, the medical condition controlled, just like diabetes and high blood pressure. I mean, that's really how we manage things these days. And I agree with everything everyone's saying that, even for patients where they have a surgery, let's say, for example, for breast cancer, and then they receive a defined course of treatment and we're treating them with curative intent, it's like the regularity of the appointments and the check-ins and the lab starts to breed a sense of security for the patient. And then you get into this period when the chemo stops for those kinds of patients where, we'll be talking, I say, well, you're now leaving the period of disease and entering the period of dis-ease. And, then that's normal, that's natural. You just stress to them, you're only human. These are human emotions. But I always try to tell them, you've had cancer or you have cancer, but don't let cancer have you. Like, you fight just as hard to reclaim your life, resume your activities, be with your family, take vacations. And I try to reassure them, no matter what happens, Dr. Shumway, Dr. Single, Dr. Suhu and I, we will have a treatment plan to help you no matter what happens. So no matter what worst case scenario or what if scenario you can think of and can be fueled by your anxiety, we will have a solution for you. And that usually makes people feel better, along with me giving them my personal cell and then them calling me 10 to 15 times a day.
And I think you put it perfectly, because I think being able to live with it and decide what can I just accept? That there's a lot of time you could spend on the anxiety or the worry or the planning, but that's time that would go to something else. And is there some way to get up and say, this is what I'm living with today. What do I want to do today? Would I rather worry about it, or would I rather go to the park or do something frivolous or go to the beach or call you? Ideally in the car on the way to the beach. But I think being able to recognize that there are things that you give up, there are trade-offs. And would you prefer to be doing this, or would you prefer to be doing this? And sometimes it's like, I'd like to worry about it. It's hard not to worry about it, but I'd really rather go to the movies and enjoy the movie. And I'm gonna do that, and things, in fact, there's evidence to seem to support that if you do those other things, you may actually be better. You may be healthier. Your stress levels will be lower. All the things that you might get more exercise, you might get better sleep.
Right. So we're going to talk about that whole lifestyle thing in a minute.
I always tell my patients too, when speaking to that, because a lot of them say, go to the movie. Dr. Drummond, are you serious? Do you know what I just went through? And, I always tell my patients, I usually get a laugh out of this. I say, listen, until everything stabilizes, just pretend you're having fun, and you might have a little by accident.
But you always tell your patients, and I think to some extent I do, and probably you do, is that when your mind and your body is anchored, then you do so much better, right? And I have a friend of mine who said he had this terrible anxiety about lots of things, and he always used to go running. And he said, for years I thought I was going to outrun my anxiety, but my anxiety kept catching up with me everywhere that I went. And so he said he finally decided that he would just put his anxiety on his shoulder and just run with his anxiety instead of trying to outrun his anxiety, because that wasn't going to work so well. So it's a very interesting thing that he personified his anxiety. And he knew when his anxiety was going to be there with him, and just did it that way. So he said, "Oh, come anxiety, we're going to go to the movies. Let's go." Here, I'll buy you an extra seat. I know it'll cost me a little more money, but I'm going to go.
Yeah, that's my train of thought.
So it was, yeah. So that's the way he dealt with this thing that he carried with him. And he talks about it, and it's so funny for him to personify anxiety, but with the idea that some things you can't get out of being anxious about, right? The C word, whether it's little c or big C, causes people a lot of fright.
I always tell my patients, it's okay to have anxiety. Nothing is 100% in cancer. There's always a chance that something can, recur or come back, and we know that. And there's a term for it, it's scanxiety, right?
Yeah.
I mean, your scan's coming up, you're getting anxious, or your blood work or whatever it may be. And that's normal, but I think what Dr. Dormady said is key, and I say the same thing, you're a cancer patient or a cancer survivor, and that's a part of your identity now, but it's not the only part of your identity, right? You have family, you have friends, you have hobbies, you have plenty of other things. And I hope you make those things, an important part of your identity going forward.
Right. And so tell me, Dr. Germany, what % of our patients are actually cancer survivors?
Well, before we do that, I remembered my joke. It's not really a joke, but the old saying, I always like this one, it's not waiting for the rain to stop, it's learning how to dance in the rain. So that sort of thing. Okay, how many of
What
our
percent?
patients,
Yeah,
what
what percent?
percentage are survivors? Well, that's kind of a trick question. My answer to that would be 100%, because if they're coming into the office, they're surviving with or have survived cancer, and trying to stress the mentality we said before, which is even if you have metastatic disease and you're receiving regular treatments, it's still under control, and you can put many of those patients into durable, complete remissions. So I would say any cancer patient, no matter, regardless of what their stage is, when you're in the fight and you're getting your treatments and you're, seeing your doctors, you are a survivor right then and there. So that's why I say 100%.
That's right. And, there's a lot of people who are afraid of surgery, right? They don't want surgery. And often I'm the first person who has to tell them, listen, this is the disease, they've come in, and my colleagues, as wonderful as they are, who are the diagnostic specialties, they say, oh no, Dr. Single will take care of it. She'll tell you everything that's going on. And so these people come in and they're completely freaked out. They've read on the internet, they come in with 600 questions, and yet they're so afraid that they can't hear what you're saying. So often I'll schedule 2 visits, because the first visit is kind of, okay, this is the plan, we're gonna do these things, but then there's kind of a follow-up visit, because then you have to actually hear the plan because it's so overwhelming. And so we always talk about taking somebody with you and all of these things, but really it's just this shock of knowing that disease. And I have called it this life quake. I mean, that's the word I use for it, because there's some life quakes that are great, right? You're pregnant, you bought a new house, some stuff, but some life quakes are really difficult to adjust to. And if you have any tips you think, Catherine, to adjust to that diagnosis point.
It's hard because I can think back to walking into that room and hearing it and having friends and having the knowledge and the scaffolding to hear what you're saying and still thinking, what did he just say? So I hear that experience. I think part of it is recognizing that it's not all going to happen at the same time. That it isn't going to happen in the visit, that the expectation is the patient is not going to be able to absorb that. Because sometimes I think people come in thinking, I'm supposed to be able to do this. You read on the internet, I'm supposed to be my own doctor. And sometimes that can be helpful because you bring information to the team to help you, but also that can be difficult because I think the responsibility and the control the worry about that you're supposed to be able to make a decision. And sometimes I don't think people are ready to hear that and absorb that and feel in control of that decision. So I think I like the idea that it's possible to have a second appointment.
Yeah.
I think it's always good to have family there because sometimes the family can take notes and you can go over it later. But I also, when I do, my specialty in psychiatry is treatment-resistant depression. So depression that hasn't responded to other things. So I use some of the higher level treatments like electroconvulsive therapy and so on. And often when I meet with them for that first time, it's the same experience. This is a bigger treatment and it requires all these things. And I often will start out by saying to patients, you're gonna not even remember 3 things maybe that I said. I'm gonna walk through the 50 that I need to walk through because I need to go through my thought process out loud for you. So you hear it and you know that I have a plan for you. But I'm not expecting you to remember the plan. I will go over that plan with you as many times as you need it. So for me, I think it's something about recognizing that you're gonna do the best you can. We're gonna get through this. We're in this together. Someone has a plan, it's laid out, but you don't have to be the one that's necessarily responsible or worry about it. But we're in it together. So there's some part of something that I think the patient has to manage that control and the loss of control that comes with a diagnosis of cancer.
Right. So I look at people's health as a partnership. It's a partnership between things that are sort of on the patient side and things that are on the doctor side and the health system side. And one of the things that's on the patient side, which has become more and more bundled into lifestyle and self-care and all of these things. And it turns out that there's data. So there's actually data to say people who do exercise and do some of these lifestyle things. So I'm just going to list them off. And, obviously not everybody does everything, but the data for it says that the patients who have adopted these lifestyle things have better quality of life, better overall survival, decreased risk of recurrence, and some of these things to the tune of 30 to 50%. Now, that means that this is medicine just as much as everything else is medicine, right? That's what that means. So I'm going to list them off. So it's positive mental attitude. And when I say positive mental attitude, I really mean it's not putting little notes in the gratitude jar or doing the mindfulness. It's really about envisioning a future, right? Envisioning a future in which you're going forward. Sleep, 6 to 8 hours a night. Sense of community. So you have to not be isolated from your community. You still have to have friends, go to the movies, get out, all of those things that we talk about. Food is medicine. Now, food is medicine is an interesting thing. So our dietitian will talk to you later about food is medicine. But what I tell my patients is it's sort of 4 tiers of choices and aspirational things. The first tier is really looking at your plate. And we did this program here called Cancer Healthy, where it's quarter starch, quarter protein, half fruits and vegetables on a 10-inch plate. So every day when you look at your plate, you should know whether you're in compliance with that, because either it'll have half the plate is potatoes or half of it will be green vegetables or something. And then there's colors of the rainbow, where if you're supposed to eat colors of the rainbow every day to get all your antioxidants, fruits and vegetables. And then kind of the higher tier is to eat 9 servings of fruits and vegetables the size of your palm. Now, 9 servings of fruits and vegetables, really difficult, really difficult. So you can juice some of it, eat some of it, aspire to eat more of it, whatever it is. And then the last tier, which just came out, which is mind numbing. And to be fair, I've been trying it now for 6 months. Okay. It's really difficult. Is 30 different fruits and vegetables in a week. 30 different ones. Not the same old one from last week, but 30 different ones. And I've only managed to get up to 15, but it's aspirational and it's really hard. So, anyways,
Strawberry jam doesn't count as one of them.
it does.
It does.
It
Okay,
does.
There we go.
It does.
I've managed to
can't eat
do
it this
30
week or next.
different hamburgers in a week.
Right, but you have to put one different more vegetable on it.
It speaks to the trying to do something a little bit better.
Yeah.
There are certain decisions you got to make for the day, whether it's I've got to have the surgery and I'll work on the other parts later. Or maybe I'm going to do 4 or 5 vegetables today.
Right. And then the last one is exercise. Now, exercise turns out to be the thing, if you're going to take out one of these things that I just said, exercise is going to be the one, because exercise and movement turn out that it reduces your risk of recurrence by almost 50%. It improves your quality of life. All of these decreases your risk of depression, decreases your anxiety, decreases your side effects, all of these things. Now, why don't cancer patients exercise? Okay, for it's the same reason all 5 of us don't exercise, right? You don't have time, it's too hard, you got 50 other things to do, right? But if you really thought that that exercise was improving your health and improving how you receive your medicine or decreasing your risk of something happening, maybe that would be your choice. And so the Society of Orthopedics says 150 minutes to 300 minutes a week of active lifestyle. And what active lifestyle means is that you're doing enough exercise that you can talk, but you can't sing. All right. So it's a big ask, right? But it has a big reward to it. So these are the lifestyle things. And so I don't know what you all have comments about it, but what you,
Well, I agree with you completely. When I'm talking to a patient and we're about to embark on a course of therapy, you know, and side effects can be so unpredictable for patients. I always tell them, you have, you know, Hulk Hogan used to always call them the 3 demandments, you know, train, train, say your prayers and take your vitamins. Now, unfortunately for Hulk Hogan, the vitamin was anabolic steroids, but, you know, I tease them. And again, you know, I think humor is a good tool to help patients diffuse some of their anxiety. But I say your 3 demandments are different from Hulk Hogan's though. Though similar. One is train, the exercise you were talking about. And I tell patients, you know, it's more than even what Dr. Single says, you know, we don't have time, we have 1,000 things to do, life goes on, and yet they also have cancer, so they could be vomiting profusely. Most of the drugs we give cause anywhere from significant to debilitating fatigue. And so it's like, I tell them the gravitational pull to the sofa and the recliner chair and your bed, it's gonna be overpowering and you must fight through that. And then, but people get in their minds, well, exercise, they're thinking, go to the gym for 3 hours a day. And I try to stress to them, all I'm talking about is trying to walk for 20 or 30 minutes, just a gentle level walk, 3 or 4 times a week. Now, if you feel like you can do more than that, go ahead and do it. But try to keep that as a minimum. So that's, you know, demandment number 1, train. Demandment number 2, well, take your vitamins to me translates to eating as much as you can. I always tell patients when you're on treatment and you need every iota of strength that you can muster, I want you on a seafood diet. If you see food, you eat it. So I tell them that when you're going through the treatment, really don't get too hung up on being restrictive with what you eat. If something looks good that day and is going down okay, then eat that. It's critical to maintain your energy and your weight as you go through the treatment. So if one day all that sounds good is ice cream, which is a big hit with most patients, it goes down easily. And then on that day, eat ice cream. And that's the second thing. The third thing is I try to stress to them the critical nature of drinking enough water. And it's just something that even with patients going through treatment, it can be an afterthought. But I tell patients, for example, our patients who have head and neck cancers, that they need to drink a gallon of fluid a day, the fluid being anything that doesn't contain alcohol or caffeine. I tell the other patients, make it a goal to try to get down 2 liters of fluid. I'm always using, you know, a 2-liter Coke bottle as my visual. And everyone gets that, like, oh, that's 2 liters, okay. And I try to stress to them, that doesn't mean wait until 8 o'clock at night and chug 2 liters of water. You have to make it a constant sipping and gulping throughout the day. What does that do? All these things, they maintain your strength, they minimize your side effects, and exercise in particular even helps the therapy work more effectively. So that's my.
right, and, you know, we have all different abilities of people as they finish treatment, right? But the idea is that if you can even do 7 minutes of just a small bar or a small anything to get yourself moving, the benefit that you see is substantial. And so, you know, it's not easy for sure to get yourself up and do it, but it's a an adjunctive thing that you, the patient, has control to do, right? You have something that you can invest in yourself and invest in your future. And so that's how I propose to patients that it prepares you for surgery, it prepares you for all these different things. And I've said to a lot of the patients that are undergoing surgery, like, I want you to maintain your weight, same idea. But Brazil nuts, Cheesecake Factory, please feel free to eat as much as all of that is as you need to eat. I want to change gears just slightly, because one of the things that helps people be in the mood and be more positive minded is that they plan some kind of travel, right? So I got invited a bunch of months ago to be on a radio show called Travel, Adventure, and Wellness. And so I've invited some of my friends to be on the show as well. And so Dr. Dormady was on, Dr. Taylor was on one time. And so talk to me a little bit about what you tell your patients about when they can travel.
Yeah, so for most patients after radiation, the side effects and symptoms are going to resolve in about 4 to 6 weeks, and most patients will be pretty much back to baseline, especially Dr. Dormady mentioned fatigue. That's a big side effect from radiation. And I think that's one of the most limiting factors in terms of travel. I encourage patients to travel. I encourage patients to go and live their life and do what they want to. If it's big travel, I do typically encourage patients to wait about a month or so after treatment before they do that. Local small weekend trips are fine, but for the bigger travel, I definitely recommend waiting a little bit.
I see. Anything else you tell them?
I tell them to go and have fun and live their life. I mean,
I
want
see.
them- I want
Okay.
them to- Yeah, I want them to experience what they want to do. I don't want the treatment or their, cancer diagnosis to be a limiting factor for doing what they're planning to do.
Okay, Dr. Taylor, he says, don't go traveling for a
Yeah, I
month.
was like out of there. The minute radiation was over.
Well, there's, on that note, there's different types of radiation and
Right.
some have much less
No,
side
and
effects.
I
So-
will say,
So that does depend on the patient.
it totally does. And I will say actually that when I heard the doctor say you're gonna feel tired from radiation, I didn't actually believe it. And I thought, whatever, this isn't really gonna be that way. And I will say it was surprising how the fatigue happened.
Yeah.
And you could feel it happen. It didn't necessarily happen right at the beginning, and it was
Right.
towards the end or even being done with it. And I thought, I tried to turn it in my mind that maybe this is my body repairing itself, or maybe this is actually part of the healing process. That's kind of what I told myself. But I think that was actually something that was really good to be able to recognize, is that it's not a criticism if you're tired, that it's actually something that happens to you. And so, yes, I think being able to figure out what you can do. I was going to sit on a beach in Hawaii because that was what, to me, you could sit there. But I think for some people, if you are tired, it almost goes to what you were speaking about with, is there some way to make a habit? Like, is the exercise a habit or the travel a habit? Is it something that you want to have in your life? Because I think there's something about making a habit that makes it easier for your brain to do it. If from the psychiatric perspective, if you think positive thoughts, then you make the patterns in your brain, or you decrease the anxiety with meditation. It actually makes neurological changes in your brain. And same thing, I think, with exercise. Like, I'll tell people, I just want you to touch the mailbox. Because once you got your shoes on and your clothes on to go out to the mailbox, maybe you'll keep doing, but the habit of doing something, or the habit of making the travel, so that you have a habit that this is something I do, it makes it easier.
Yeah. Well, I'm gonna make some fun of you because,
Totally.
okay, because she told me this, radiation finished at 10:30 in the morning, and what time was your flight?
Yeah. But I couldn't make the tickets. The tickets were made by someone else and I just I needed to show up. That was my role was to show up. So sometimes being able to depend on other people. But
So Dr. Suhu,
yes.
a lot of the patients want to go somewhere in the sun. What restrictions might you place upon them?
Right.
I want everybody to have fun. I really do. And I think people need to enjoy their lives. But I would say, not just for cancer survivors, but for everyone, we know that the sun is a carcinogen. So let's be smart about it. Let's protect our skin as much as possible. I always tell my patients that your skin is like money in the bank. And every time you go out, you're spending it. and there's no opportunity for more deposits. So let's save as much as we can. So how do you do that smartly so that you can have fun still? Well, sunscreen, of course, everybody knows about sunscreen, but what you might not know about sunscreen is it's not foolproof. It's kind of like a filtered cigarette. So like you should use it like that. You should not depend on it to be protecting you 100% in the sun. So what's better? I definitely want you to wear sunscreen. There are different types. We could go into that, but honestly, any sunscreen that you're going to use is the best sunscreen to use, SPF 30 or higher. Clothing is going to be much better than sunscreen. You don't have to reapply it, but you should know about fabrics. The lighter the color the darker the color and the tighter the weave, the more protective. So blue jeans are going to be a lot better. So you get an SPF of about 5 with a white t-shirt because the fibers are not absorbing the light and there are holes, because the weave is light. And then when it gets wet, the fibers swell apart even more. So it goes to about a 2, SPF 2. So really you want to wear clothing. If you want to wear white clothing, look into UPF clothing that's white and tightly woven, and it's been proven in a lab to have an SPF 50 or higher. You can get those online, a lot of places, or at your local sporting goods store. So those are really important things to remember. So, and you don't have to put sunscreen under those clothes. That's kind of nice, right? You don't have to reapply it every 2 wide brimmed hat, a baseball cap only covers the top of your head and maybe this part above my fingers on your forehead. So a lot of skin cancer, especially non-melanoma skin cancer, we see on the nose, the ears, the cheeks, you don't get much protection from a baseball cap. So think about a cap with at least, a 4-inch brim. And think about time of day. So when I go to Hawaii, I love to go to Hawaii. It's great, but I like to go hiking in Hawaii at high noon, between 10 and 2, and then maybe go into the surf later in the afternoon. So things like that, you can still have fun, but be smart about it. And don't forget your sunglasses either.
No, certainly I can speak to that with my coloring and the history. I think since my 20s, it's been the wide brimmed hats. I usually actually have 2 swim shirts because you can have one that's dry and one that's wet. But being able to go in with the swim shirts, I think there's been a huge change in that I've seen over the last 10 years. The willingness and the cool factor for the various shirts for the kids.
Yeah, you can buy them at Walgreens now and not feel like you're, out of fashion.
A lot of the medication you give lead to photosensitivity too, yeah?
Absolutely. I was going to just clarify one statement that Dr. Suhu just made. If you wear a baseball hat or a hat supporting the Minnesota Vikings, that protects your whole before I answer your question, there's one thing that I would feel remiss if I didn't mention. There's one thing that I've also found as we try to help patients survive and thrive, while on treatment, after treatment, the nutrition, the hydration, the exercise, mindfulness is so important. But I often will get into the area or even explore it a little bit with the patient, touch on the idea of faith and prayer to if you get, not everyone is religious, but I have found over doing this for, almost 30 years now that the patients who are strong in whatever faith they have, it's an incredible way to do all the things we're talking about and sort of take the package of anxiety and offload it in a place where there's acceptance of the patient can't control everything. So we're going to move this over to, for some patients, God, and that allows them to focus on the things we're telling them a little better. So, not everyone is religious, but in patients who are, I do stress them, rely on your faith too, and make that an integral part of your own mindfulness. But as far as the drugs we get, the drugs we give, many of them not only cause photosensitivity, but Dr. Suhu, because I've sent some of our patients to you, some of them cause overt, severe skin eruptions, rashes, lesions, blisters. Between the cancer itself that can do that, and then the treatments for the cancer that can do that. Yeah, sometimes it goes way beyond photosensitivity. It goes to overt skin damage. Fingernails falling off, toenails falling off. But with respect to what you're saying, Shamli, I think, yeah, be very careful, even if you don't have a terrible rash from a drug. Almost all of the drugs we give increase photosensitivity. And so it just makes what Dr. Suhu's saying 100 times more important, because if you start to develop a skin eruption from too much skin exposure, and one of the drugs is playing a role in that, the reactions can be horrific. So you have to be really careful.
So again, so I'm going to give you a couple of tips if you decide you're going to travel, which, you can call Dr. Dormady if you want to. But the thing that might also help you is to take just a page in your carry-on or with you of your medications and your history, just in case wherever you go, something happens. You have your information with you. You keep all your medications in your carry-on bag because you don't want you to go to Bali and it to go to Zimbabwe, right? You just want all your medications to be with you. You'd have to take enough for the duration of your trip. The other thing is that there is lots of support for you in your travel insurance, in your other places, in your MasterCard, your Visa, for things that might happen to you, later, right? If something should happen to you as that goes, all right? So it's just something to consider as you travel. We want you to travel. We want you to go to places that are safe. And if there are things that are limiting items, then limiting items, you don't have to do every activity, as Dr. Dormady, if you go to an all-inclusive resort, right, you don't have to do every activity all day long, right? You can do some of them, you can do what you like, and just sort of plan your vacation. But I would also make a pitch for taking day trips here and there, right? Because if you're during treatment, you're somewhere, you can go take the day off and, go somewhere, right? And it's a big clearing of your mind, right? You're not in the moment. And I think that we don't emphasize that enough, that you don't have to wait until the end of treatment. You don't have to wait until something is finished to take that moment.
Absolutely. You're making a joke about the comment I made when I was on your radio show, which was the moderator asked, what about your activities when you're on vacation? And I do see that with our patients, the patients, it's like, I try to tell them, please just understand that even on the days you feel good, if you're being treated, the medicines are so powerful. You're like one activity away of being wiped out for 3 days. So just pace yourself. And when you go on vacation, don't sign up for parasailing at 8 a.m., then the mountain hike at 11 a.m., the shark adventure at 2 p.m. And patients do that. And then, patients come back.
You're not a failure if you can't do all those items.
Right, exactly. Just pace yourself a bit. Some patients have come back and I've had to admit them to the hospital for dehydration because they've overdone it so much, and they just come back debilitated with fatigue. And then I ask them, well, did you just take it easy? Were you at the beach? Oh, no. And they're doing all the itinerary. I was like, but yeah, just pace yourself.
And even during treatment, sometimes I tell people when they're getting better from depression or from anxiety or working, is there something, there's a reason we have Monday through Friday and the weekend. And weekend warrior, we all know what that,
Yeah.
don't be a weekend warrior, but can you insert some of those frivolous activities? Is there something that you can do in the middle of the treatment, like you're saying, a day trip? Is there something you can do that will take away the distraction, but maybe help you learn how to piece it?
And what you guys all might not realize is that there are specialty people. There are oncology estheticians, there's oncology massage people, there's oncology exercise specialists. There's a whole service industry of taking care of cancer patients. There's a bunch of them in downtown Los Altos, actually, that are specific that really understand what you're going through, how you're going through it, and all that stuff. So if you want a break, you want a moment of normalcy, if you want any of that stuff, and even some of these resorts, right? They have, all you have to do is tell the concierge person that you have this disease, and they will find everything for you. So you can go there and get a break from Cancer World, travel around, do what you need to do. I did have one patient who called me from from Costa Brava, and she was like, do you think I could? And you know, one of the other suggestions that I have is that you go visit your doctor a month or so before you leave and ask them if there's anything that you should take with you, anything that you should do. And the other piece of it is as you're going through TSA, if you have a lot of stuff, right, you can actually go through TSA pre, and TSA pre is a 72-hour, you book it ahead of time, and you can go through TSA a little bit more easily than trying to explain to somebody that you have your port and that's what the, you know, this is what's happening. And so it takes a little bit of the anxiety about going through TSA. And I caution people on this topic that always comes up, but what if this happens? Okay, well, even for people who aren't sick, what if something happens, right? It's the same sort of stuff, right? You still have to know where your medicines are, know what your insurance covers, know that you have travel insurance, and know that most of this stuff is fixable, right? Wherever your final destination may be, it's probably fixable, right? So I think those are sort of important ideas. So we have a question, and so I want to make sure that we are mindful to the question. And it says, "Good morning, everyone. Do you think that hormone therapy for hormone positive breast cancer has evolved in the last 10 years?"
In the last 10 years. Well, what I would say is what has evolved over the last 10 years with respect to hormonal therapy is the fact that for many patients with breast cancer, we are now doing molecular profiling on the tumor, even when they don't have metastatic disease, to see, in addition to hormonal therapy, do the tumor cells have a mutation in, for example, the PIK3CA gene, where you can add medications to hormonal therapy, and we're starting to see additive benefit, higher response rates, better outcomes. So there's that aspect of things. As hormonal therapy itself evolved, there really haven't been many new medications over the past 10 years. You know, we still use the drugs tamoxifen, the aromatase inhibitors like Arimidex and Aromacin and Femara. And they really haven't changed much. I try to tell patients when they are receiving hormonal therapy, you know, you have short-term side effects and long-term side effects. The short-term side effects, you know, we often need Dr. Taylor's help to manage things like shifts in the mood that can be unpredictable, fatigue, of course, hot flashes, sleep disturbances, sometimes dizziness. And I tell patients, just stay on the medication. Over 2 to 3 months, those will tend for most patients to fade a bit as your body acclimates to it. The longer term side effects for the aromatase inhibitors that we use most commonly these days would be, you know, bone implications for bone density, and a really vexing side effect where women will develop just achiness and stiffness all over their bodies, especially in their hands and wrists. I've had a lot of patients say, you know, I'd like to knit or do things with my hands or crafts. I just can't do it anymore. And that's a huge detractor for their quality of life. So, you know, I wish I could say that there have been, you know, great innovations made as to how we manage those side effects, but over the past 10 years, there probably haven't been too many. Although hormonal therapy for breast cancer still remains a critical tool to cure women and keep disease stable in the metastatic setting for years and decades sometimes.
So we have about 5 minutes left. Okay. So I'm just gonna go through the panel and see what tips do you have for cancer survivors? What is the number one thing you want people to remember as they go forward? Dr. Dorman?
I would just say, whatever phase of treatment you're in, we mentioned it here a couple of times, and whatever tool you use to do it, you have to keep your mind, your heart, your emotions, and your physical body all kind of integrated and moving in the right direction with positive momentum to beat cancer or keep it in remission. So just be mindful of those things, trying every day to wake up and say, you know, I'm here, I'm alive, and today's battle plan is this, and we're going to be positive, we're going to get some exercise, we're going to stay active, and just maintain that spirit as you go through. There's always hope. There's always hope. And no matter what happens, your doctors more times than not will find a solution for you. So try not to let that anxiety ruin every day.
Okay, Dr. Suhu,
Um,
what's your number one tip?
Early detection is the key. The overwhelming number of skin cancers are 100% curable, almost 100%, even with melanoma at early stages. And so don't be afraid to come in and get your total body skin exam on a regular basis, at least annually. If you've never had any skin cancer, a little bit more if you have. Let your dermatologist be your team member to help keep you safe and to detect those lesions early so that you have no interruption in your lifestyle, no debility from treatment, and no shortening of your lifespan at all.
Dr. Taylor?
Gosh, so many things. But I guess where I would say is remember why you're anxious and why you're depressed is that there's some value to what you were doing, that there are things you can do, that enjoying your day, focusing on what you can do. So you're anxious because you don't want something to change. So going back to what you did, what you were doing before, are you enjoying life? Are you happy? Is there something you can do to make today a little bit easier for yourself or a little bit better or tomorrow exciting? So to me is to focus on getting past that and what you can do.
Right. So my suggestion is that, sometimes that there's life quakes, but we want you to get back to your regularly scheduled life, right? And sometimes it means not living in cancer world and not staying in cancer world and being so afraid to leave and move forward out of it, because cancer world can be very stressful and it's very difficult to stay there all the time worried about what will happen next, right? As opposed to looking forward and saying, okay, well, I dealt with that. Now I can move on to the next thing. So,
Very
Dr.
good.
Summer.
Yeah, I would say focus on the things you can control. I think one theme here has been life happens and there are things that are out of your control, but there are things that are within your control. We've talked about nutrition, we've talked about exercise, we've talked about travel and enjoying life, and take those things that you can control and that make the most out of the situation you're in. And as your cancer doctors, we are here 100% to help you do exactly that.
Right. And on that note, I will say thank you all so much for joining us. Really appreciate that you spent your morning with us, and thank you so much to the panelists for coming and all the great information that everybody has given our patients. And see you next year.
10-minute intermission and then.
Oh, 10-minute intermission, sorry. And then we will be right back with our nutritionist, who is the highlight of our Cancer Survivorship Day.
Hello, everyone. Thank you for staying on for the second portion of our talk today. My name is Nicole. I'm the registered dietitian with the Cancer Center. And this is my first year doing this presentation. Many of you probably remember Charis. She retired last year. And so I'm honored to be here. Thank you so much for having me. Today we're going to be talking about nutrition. What's food got to do with it is what I titled this talk. I also should have included exercise because I'm going to be talking about that as well. And what a perfect segue into this talk, because the doctors we're talking a lot about nutrition and exercise, and I'm going to be going into that today with more detail. If I can get my slides to go here. I just left. Sorry about that. I'm trying to get my slide to move to the next. It's not going, so I might need some assistance here. Just give me 1 second.
Sorry about that.
That's it. I'm pushing this forward button, but it's not going.
Okay, try now.
There we go. All right. So today's topics, foods that can help fight disease and strengthen the immune system, how to make meals healthier, and also, again, we're going to be talking about exercise, physical activity guidelines. So why is nutrition important? There are so many reasons, and that's why patients come to me so we can discuss the importance. Maintaining good nutrition will help you to feel better. It's going to help you to recover faster. Maybe you're recovering from surgery or another procedure.
You send the photos.
Stay strong and have energy. So during your treatment specifically, we want you to stay as strong as you can so that your body can be at its best. And also eating well is going to give you that energy that you need to maintain. And you're going to better tolerate your treatment as well. When your body's working well, you're going to better tolerate your treatment. Same with improving your immune system. That's the foods we're going to talk about today to help strengthen your immune system. And on that same note, if your immune system is functioning well, you're going to have a less risk of infection. So just like this picture shows on the right there, if you have a garden and you're providing your garden with the nutrients it needs, with water, it's going to thrive, right? You're going to get this beautiful garden. On the left, kind of the opposite. If you are not giving your body the nutrients and not giving it adequate hydration, again, it's not going to thrive. And we also want to think about this on a cellular level. You want to think about, why is nutrition important for my body down to the cells themselves? Because our cells actually need nutrients to function well and to be healthy. And so that's what that other picture there represents. So this is what Dr. Singhal was talking about, eating the rainbow. So we want to make sure we get a variety of colors with all of our meals on a daily basis. And the reasoning is each color that is represented there is actually representing also its own unique set of vitamins and minerals and phytochemicals and antioxidants. And so it's important to make sure you're getting a variety of colors, because synergistically, those are all working together to help provide your body with what it needs. So we're going to start with cruciferous vegetables. There is a lot of research out there about cruciferous vegetables and cancer. And the ones that I think we know the most are broccoli, cauliflower, cabbage, Brussels sprouts. But there are also some that I actually, until I was putting this list together, I was like, oh, these are also under the umbrella of cruciferous vegetables. So arugula, bok choy, kale, collard greens, watercress, also radishes, rutabaga, turnips. So all of those are considered cruciferous vegetables. They are all going to be really healthy in terms of nutrition, providing the nutrition that your body needs. So they're high in vitamin C and E, which are antioxidants, vitamin K, folate, which is a B vitamin, and fiber. And a lot of questions that come up about vegetables. Am I going to decrease the nutritional value of my food if I cook it? And that varies based on the vegetable. And so with cruciferous vegetables, though, it's best to eat them raw or just slightly cooked. So steamed or stir fried. You don't want to cook these a long time because yes, they can lose some of their nutritional value. And in animal studies, the studies have actually shown that with intake of cruciferous vegetables and the compounds in these vegetables, that they protect the cells from damage and decrease inflammation. All right, and now berries. Berries are a very good source of nutrition. They are easily available, easy to add into lots of breakfast foods. So you have your strawberries, blueberries, raspberries, blackberries, and then also cranberries, elderberries, acai berries, goji berries. They are a good source of vitamins and minerals. So again, we have vitamin C up there, also a very good source of fiber. And they contain something called polyphenols. So polyphenols are anti-inflammatory compounds. They act as antioxidants, and they contain something called prebiotic fiber, which actually feeds the good bacteria in your gut. And so that's why eating berries is so important. Also red and orange fruits and vegetables. So that really deep color. You can see I have a list there on the top of the red fruits and vegetables and then the orange. And these contain something called carotenoids. And so you've probably heard of some of these: beta carotene, which is converted to vitamin A. There's lycopene, which is readily available in tomatoes. And then lutein, which is good for eye health. So these red fruits and vegetables are really important for eye health. They also act as antioxidants, again, strengthening your immune system, and they are anti-inflammatory as well. And dark green leafy vegetables. So we're working our way through the rainbow, lots of colors. Again, probably the most well-known or mostly used ones are spinach, kale, Swiss chard, beet greens. But again, there are so many different varieties of these green leafy vegetables. And again, lots of vitamins, they have minerals, anti-inflammatory, they contain fiber. Again, fiber is really good for your GI tract. And with dark green leafy vegetables, it's good to eat a variety of these. You don't want to just eat one of these, for example, spinach all the time. You want to get a good variety of these green leafy vegetables. So I want to highlight one of these minerals quickly, iron, because I get a lot of questions about iron. We have patients who are iron deficient and they want to improve their iron status. So this is just a guideline for your daily intake of iron. Now, this is if you have a sufficient amount of iron in your body. If you're deficient, you need much more than this, which is why some of our patients get iron supplements recommended or iron infusions. But if you have a sufficient amount of iron, this is your daily intake. So 8 milligrams for men, and then 18 milligrams for women if you're within a certain age range. Over 50 years old, the women's iron recommendation goes down because we stop menstruating at a certain point, and so your iron needs aren't as high. That's where the difference comes in. And let's look at plant sources of iron versus animal sources. So you have these green leafy vegetables that I was mentioning that contain iron. There is some iron. It's not quite as much as an animal source. So you can see there's spinach, there's broccoli. There are a couple milligrams, 1 to 3 milligrams of iron versus our animal sources. So 3 ounces of meat, which is about the size of the palm of your hand. That contains, so beef has 3 milligrams, chicken and turkey have 1 milligram. Beef liver actually is a really good source of iron, as well as oysters. A lot of people don't realize that. So I'm not saying to eat oysters every day, but when you do eat oysters, just keep in mind they are rich in iron. And so let's talk about, okay, can I still get iron from these leafy green vegetables? And the answer is yes, especially if you pair them with foods that are high in vitamin C. So how can we do that? You can add vitamin C rich foods. So oranges, strawberries, kiwi, you can add that to a salad that has leafy green vegetables. Or I should say, and you can also do something like broccoli, which has some iron and also vitamin C with your leafy greens. And then you can use bell pepper as well. Bell pepper is going to be that high source of vitamin C. So that's a way you can pair them together if it's not a meat source and get better absorption. All right, garlic and onion. So these, again, have been highly researched in terms of cancer. And a lot of the lab studies have shown that they can reduce tumor growth, they act as antioxidants, and they can help to regulate blood sugar. Actually, a lot of these foods I'm talking about today are good for blood sugar control. They can decrease inflammation. And some studies have shown, you know, when it comes to human studies, there are just kind of some mixed results. So some human studies have shown the risk of colorectal cancer is decreased, but the results do vary, so it's not super strong. But a lot of studies have shown that people that eat high amounts of garlic and onions tend to have better outcomes. So they tend to eat probably garlic and onions every day. Another food group or types of food I wanted to talk about are nuts and seeds. So again, so many different varieties of nuts and seeds. And I actually talk about these with patients who are having trouble with weight loss. So they're losing weight. And so I talked to them about, why don't you try including nuts or nut butters, almond butter, peanut butter, cashew butter, in order to boost your caloric intake. And same with seeds. We don't realize that seeds can be readily added to lots of different foods, and they do contain a good amount of calories. And these are actually, these are really beneficial because they have so many good things. So nuts and seeds contain healthy fat. They also contain protein and fiber. So that's like a 3-in-1. And they also contain vitamins and minerals. And a lot of studies have shown that they act as antioxidants, they're anti-inflammatory. Again, because of the fiber content, they're good for the gut microbiome. And a lot of human studies have shown that eating 1 ounce of nuts per day can decrease risk of heart disease, and it's just better for weight management. And then herbs and spices. I have a long list here of different herbs and spices. You can think about your own cabinet at home and which of these you have and which of them you use. Herbs and spices, again, have been shown to be anti-inflammatory, antioxidant rich. And I just wanted to point out one in particular, curcumin, which is a compound in turmeric, has been shown to decrease the risk of cancer cells, like the growth of cancer cells in the lab. And in addition to patients asking me what should I eat, they also ask me what should I avoid. And one of the main things I talk about is processed meats. Bacon, sausage, hot dogs, salami, all of those cured meats. There's been research that shows high intake of those foods is actually correlated with an increased risk of colorectal cancers. And then again, you can see there like a pantry full of processed foods. So you're probably going to have some condiments like mayonnaise and salad dressing and mustard, but the other foods there you don't want to have all the time. So things that come in boxes or cans, things that are highly processed. And in addition to that, foods that are a pure source of sugar, soda, donuts, candy, these are just going to increase blood sugar. And again, there's no nutritional value that it's going to be bringing. So every once in a while is fine, just not consistently. All right, so let's talk about making meals healthier, and I wanted to give some really good specifics here. So Dr. Singal had mentioned half your plate being fruits and vegetables, a quarter grains, and a quarter protein. And this is the My Plate graphic that's used. Many years ago, this replaced the old food pyramid. So this is the new graphic in terms of having balanced meals. You also have dairy there in the graphic. And there's another example called the New American Plate. And that has 1/3 of your plate being animal protein, and then 2/3 being fruits and vegetables and grains and all of your plant foods. And if you were in the clinic in March, that was National Nutrition Month. I actually printed these 2 pages and I had them out on the table for patients to take. This is something you can use as a tool when you're planning your meals. So when you're doing your grocery list, there's the different food groups there. You can make sure you're filling in all of them to get a good amount of variety. And there's a calendar there as well. So you can look at your weekly meals if you're planning them out, breakfast, lunch, dinner, and snacks. And as you're planning your meals out, then you can figure out which individual foods you need. And again, make sure you're hitting all of those food groups. So breakfast, for example, we have just a generic, probably non-whole grain bowl of cereal. And then another breakfast that maybe looks healthy because there are some berries on there, but also this is probably another high source of sugar because under the berries are these little cake pastry type things. And so this is something that would just be more of a sugar source. So what's the alternative? Something like oatmeal, which is going to be a good source of fiber. On top of your oatmeal, you can add fruit, you can add seeds, nuts, just for a well-rounded breakfast. Also an omelet, so you have your eggs for your protein source, a side of fruit, maybe a side of whole grain bread, and then your vegetables as well. So going back to the My Plate graphic, I wanted to show and make sure we're hitting all of those food groups. So you have, again, whole grain bread. Buckwheat is a whole grain that can be used for pancakes, so it's not just white flour being used. Again, oatmeal, quinoa is something else that some people eat for breakfast. It can be eaten like a hot cereal, and you can add to it. You can do dairy or non-dairy milk, yogurt. I talk about yogurt a lot as a good protein source with breakfast. You can add cheese to the omelet. Again, your protein sources would be eggs. You can have beans, nuts and seeds, nut butters, also protein powders. Some people will do a scoop of protein powder, maybe in their coffee or tea for that added protein in the morning. You can add vegetables. You can add leafy greens to your omelet. You can do bell pepper, onion, avocado, so many different things you can add. And we were talking about herbs and spices. So maybe with your oatmeal, you're adding cinnamon, ginger, cloves. That's kind of that pumpkin spice. And in terms of fruit, it's easy to add fruit to breakfast. You can have berries or apples, melon, so lots of different things there. All right, let's talk about soup as well. So this is just probably a can of chicken noodle soup. And how can we make that healthier? If you see the graphic there on the right, it's so much more vibrant with color. There are different vegetables, probably herbs and spices as well. So let's hit all those food groups here. So with soups, you can add rice, you can add quinoa, barley, those whole grains, maybe whole grain pasta. Again, some soups call for a milk, maybe like a creamy soup. You could do dairy or non-dairy milk. Coconut milk is a good option. For your protein source, chicken, beans, lentils, tofu. And some companies are actually making a high protein pasta now. The pasta is made with lentil or chickpeas. And so you're getting a good protein source, but from your pasta. And so many vegetables you can add. The list just goes on and on. You can be really creative with soups, adding lots of different vegetables, as well as herbs and spices. Fruit is not as easy to add to soup, but you could do lemon juice or lime juice or zest. And I like to talk to my patients about pureed soup because you can take a vegetable soup and maybe someone is only able to take in liquids, or maybe they are having nausea and just something chunky or kind of feels heavy, doesn't feel or sound appealing. So you could do a pureed soup. You can take a soup that has maybe carrots, cauliflower, different onion, garlic, different things. You can just simmer it for maybe 15 minutes and then put it in the blender, blend it up. And it's something that becomes a creamy soup that's just easy to eat with a spoon, but it's packed with nutrients. And kind of on that same note, I like to talk a lot about smoothies as well, because smoothies are another source of a lot of different good foods like berries and yogurt. So you're getting a lot of nutrients all in one. But again, it's easier to just take something and sip it. It's nice and cold, and it's going to be easier than maybe fixing this big breakfast. Let's move on to pasta. So we have kind of a basic marinara or Alfredo pasta, and how can we make that healthier? So something like adding more vegetables, just like with the soups, you can add lots of vegetables to make that more nutritious and vibrant with color. So you could do a whole grain, whole wheat pasta. There are also different pastas maybe made with quinoa or rice. You could do dairy or non-dairy cheese with your pasta. Your protein sources would be chicken, maybe lean beef, fish. You could do beans, tofu, and again, those high protein pastas. And so many vegetables. Again, such a wide variety of things you can add. And then again, lemon or lime juice, because it's not as easy to add fruit to a pasta dish. Another option would be if you have a marinara sauce and you want to add to it. So again, maybe you simmer some vegetables, you add it to your marinara sauce, put it in the blender, blend it up, and then you have this nice nutritious topping for your pasta. But it has a wide variety of different vegetables. And again, it's not the whole vegetable. Maybe it's more of like a sauce. And then potatoes. So a lot of us have potatoes with our meals, but how can we make those healthier? So on the top picture there, there's a sweet potato, like a loaded sweet potato with lots of leafy greens. There are some nuts added for protein. You have pomegranate seeds. And then the second graphic there would be more of a sheet pan with, instead of just the white potatoes, maybe you do red potatoes because you're gonna get, again, more benefit from the color, more vitamins and minerals. You can add herbs and spices, you can add garlic, olive oil, all of these things to enhance the nutritional value. And let's make sure we hit all of those food groups. Quinoa or brown rice could be added as a whole grain source. Dairy or non-dairy cheese, sour cream, or Greek yogurt as an alternative. Chicken, beans, tofu, and nuts as a protein source. Lots of different vegetables, tomatoes, bell pepper, leafy green vegetables, cauliflower, broccoli, so many different things you can add. And then I liked that this graphic included the pomegranate seeds. I thought that was really special. And then also another thing is maybe mango or pears. There are some fruits you can add as well. And last but not least, we have pizza. And I should mention as I'm going through these foods, these are more American style meals because I think those are the ones that tend to be lacking the fruits and vegetables. When you think about other cultural foods, foods around the world, they do tend to include more vegetables. And so that's why I'm kind of focusing on these more American style meals. But here you can see on the left, this is more of a meat lovers pizza. And then on the right, we have more of a vegetarian style pizza. Lots of color, so many different things you can add. In terms of the crust, maybe a whole wheat crust or a cauliflower crust, which is very readily available. You could do dairy or non-dairy cheese for your protein source, chicken, pine nuts, walnuts. Oh, did I lose my clicker there?
Should be good now.
All right, so many toppings. That's what's nice about pizza. They have lots of different vegetable toppings, herbs and spices, and then you could top with fruit as well. How are we doing on time? Doing okay? All right, and my last topic is physical activity. And again, the doctors touched on this and I wanted to get into those details. Why is exercise important? So many reasons. I'm not gonna read all these off, but so many good benefits of exercise. And for the purposes of this talk today, I wanted to just focus on a few of these bullet points. So slowed or reduced weight gain, improved bone health, and then decreased risk of certain cancers and cancer recurrence. So how much? Think about how much exercise do adults need? At least 150 minutes of moderate intensity exercise per week. So that's 2.5 hours per week. And what is moderate intensity? That's something like walking, yard work, bike riding, doubles tennis, or pickleball, because I know pickleball is very popular, dancing or recreational swimming. Or, and this is or, you could do more vigorous activity for 75 minutes a week. So that's an hour and 15 minutes. That's something that's going to get your heart rate up more. So jogging, running, cycling, singles tennis, swimming laps, jumping rope, hiking, step aerobics, or kickboxing. So these are going to be things that are going to be more, again, getting your heart rate up more. And if you're doing those, the guidelines show that you don't need as much in terms of time. In addition to this, so that one was an or, this one is an and. You also want to get at least 2 weeks per week, 2 days per week of muscle strengthening activity. And that is going to be what is good for your bone health. So anytime you're using your own body weight or you're using, you're lifting weights or you're doing some sort of weight-bearing exercise, that's gonna be really good for your bone health. So let's make this more realistic because I get some patients who say, I'm not active at all. You know, where can I start? Or I haven't been active in years. So this is just something I came up with. This isn't, this isn't a guideline. This is just something I came up with as a realistic goal. 10 minutes a day, 2 days a week. That's your goal. Just kind of like the doctors were saying, get your clothes on, walk to the mailbox. This is another realistic goal of 10 minutes a day, 2 days a week. And then you can start to increase from there. So what does that look like? Let's say you're just getting started. You can do a 10-minute walk around the block. And that can be really easy. You use your watch, you use your phone, you set a timer for 5 minutes. You take a walk. When the timer goes off, you walk back, and that's 10 minutes. So you could do that, say, on a Tuesday. And then another day of the week for 10 minutes, you do yard work. Or if you don't have a yard, maybe you have a patio or a balcony. So you clean off, you do some cleaning in that area. And that's another 10 minutes. A couple weeks later, you're still doing your 10-minute walk around the block on Tuesday. You're still doing another day of yard work. Maybe you start also including housework, something that's going to get your heart rate up, like vacuuming. And you're doing that now for 20 minutes, 1 day a week. And then a friend invites you to go do some recreational swimming. And so that's on the weekend, you do 30 to 60 minutes of swimming. And then a week or two later, you're increasing your walk. Now, instead of setting your timer for 5 minutes, you're setting it for 10 minutes. And you take a walk, and when your timer goes off, you walk back. That's 20 minutes. And now you're doing that 2 days a week, so Tuesdays and Thursdays. And then you're still doing on Sunday your recreational swimming. But when you're at the pool, you notice there's a water aerobics class that's offered, and that's an hour. And so now you start doing your 2 days a week of walking and your 1 day a week of swimming or water aerobics. And again, a question that comes up or something that patients say to me is, I can't do a lot of exercise because I have bad knees, or I can't walk, more than 20 minutes because X, Y, and Z. So swimming is a really good option because it's not going to be putting that pressure on your joints. And then a week later, you're still doing your walk, but you increase it to 30 minutes. And you're now doing it 1 day a week because you're also busy with your water aerobics 1 day a week for an hour. And then when you're at the pool, you see a flyer for a strength training class that's an hour. And so now you have 3 days a week. And right there, you have 150 minutes, 2.5 hours a week of exercise. So if you make those goals realistic and you slowly increase to something that you are going to stick with, to something that you're going to enjoy, because if you're not enjoying it, you're not going to stick with it, then it can be realistic. And I always tell patients, start now. If you say I'm going to start Monday, if you say I'm going to start on the 1st of the month, it's not going to happen. So you need to start now. Start tomorrow. Just make it happen without setting that certain date. Also, hold yourself accountable. So figure out what motivates you. Maybe it's that you want to improve your health so you can have more time with family. Maybe you want to go on vacation like they were talking about. So there's something that's a motivator. And something that can help with maintaining your routine is asking family or a friend to join you. And we're going to come up with excuses in our heads. We're going to come up with, I can't do that because X, Y, and Z. And so just ignore those excuses. Let yourself know this half hour or this hour is for me, and I'm going to go do it because I know it's important for myself. And I was talking about setting timers. You can use reminders. You can set reminders for yourself on your phone or another device to make sure you're sticking with your routine. And kind of this is my final slide, kind of a closing statement would be, make sure you're figuring out what's best for you and your body. Whether you're going through treatment, whether you're finished with treatment, you need to figure out what's going to be the best, because as the doctors were talking about, food is very important, but it can become another stressor. It can become another source of, I'm not doing this perfectly, and so I'm failing, and that's not true. You can make small changes. There's like that 80-20 rule where 80% of the time you're doing your best and you're doing what you need to do. And then 20% of the time, maybe it's, things that are outside of those guidelines. But do what you need to do to feel your best. And it's all about balance. Same with exercise. We want you to exercise, but if there's a day when you absolutely feel like you can't, take a day off and just rest and then get back to it the next day. All right. Let's see if there are questions that came through. So there's a question about, is packaged salad or vegetables in microwave pouches okay? This is my personal opinion, because when I see something in plastic that's gonna get hot, I'm not a fan. So there are studies that have shown that a water bottle that sits in the car and heats up, the plastic is heating up, can actually be, it's not healthy for your body to be having maybe the chemicals that are coming from the plastic into your water or into your food. And so I would say it's okay to buy them in that package, but don't microwave them. So maybe cut the package open and then steam the vegetables. So don't heat them up in that plastic container. And I actually again, this is my personal preference, even at home in the microwave, I don't use plastic. I use glass or I use ceramic, because again, we don't want the plastic heating up and then potentially chemicals getting into your food. Any special nutritional considerations for vegan diet and cancer treatment? So I'm wondering if that's a question about if you're already vegan or maybe going vegan. But I would think if you're vegan, the main thing that comes to mind for me is making sure you're getting your protein sources. So focusing on nuts, beans, legumes, tofu, and making sure that, again, you're getting those protein-rich sources in addition to your fruits and vegetables. So again, hitting all of those food groups when we look at the My Plate graphic. And I would also say, if you are thinking of going vegan, there are lots of different resources. I have resources. There are lots of resources online. But if it's also something where you're not vegan and then because of the cancer treatment, you decide that you want to go vegan, I would say just be cautious and make sure you're doing it right. Again, hitting all of your food groups, because you don't want to become deficient in some vitamin or mineral because now you're doing this drastic diet change. So those are the only two questions. Oh, here's another one. How do you feel about taking vitamins or supplements with already eating fairly healthy? I would say if you're already eating healthy and you're eating a variety of foods and you're making sure you're getting adequate servings of fruits and vegetables, you most likely don't need a vitamin or mineral, a vitamin or mineral supplement. If you feel like maybe you're lacking in a certain area, you can. But one thing I will say about multivitamins, if you ever look and turn and look at the label, some of the vitamins, especially B vitamins, they highly exceed your daily value. So sometimes it's 1,000, 20,000% of the amount of that vitamin you need in a day. And so sometimes it's not, your body really can't absorb that amount. So sometimes you're just gonna excrete it when you pee. If you've ever noticed, sometimes your urine can be a very bright color if you're taking a vitamin supplement. So I will say, it's not gonna be harmful to take a vitamin, but take a look at the label and make sure that it's not highly exceeding these needs, that really your body's not gonna be able to absorb that amount. And the other thing I was gonna say about vitamins and minerals, when you're going through chemo, really, you don't want to take high doses of antioxidants, so vitamin C, vitamin E, because that can interfere with your treatment. And the one vitamin I will say I do think is beneficial for people to take is vitamin D, because so many of us are deficient in vitamin D as it is. And so I think if anything, that would be one to take consistently. All right, so I think that's all of our questions. Thank you all so much for tuning in today. I hope you got some really good information, some valuable information. And I work at the Cancer Center. I also cover the radiation oncology clinic. So if you ever have questions, please feel free to ask to meet with me.